Hi, I'm Dr. Rob Silverman, Amazon best-selling author of Inside Out Health and host of Proven Health Alternatives. Today's guest, Dr. Joel Evans, without question, explained very clearly and eloquently the FIT test, the food inflammation test. We spoke all about how food sensitivities are a critical element for baseline treatment in most doctors' offices, and he shared some interesting insights into how the food can damage your gut. And as we all know, the gut is the center of all our immune system. It's a can't miss. Hey everybody, Dr. Rob Silverman here, Proven Health Alternatives. I've got a great guest today. You're going to love what he's got to say. We're really going to talk about a blood test. We're going to talk and specialize on women's health. We've got Dr. Joel Evans today. Doc, how are you?
Hey, good to be here. I'm doing well, thanks.
I'm happy we have you. I mean, you have an extensive bio. So let me go through the bio. We always go through the bio at the start, kind of
Sure.
not get out of the way, but there's a lot here. Dr. Joel M. Evans, MD. You're a board certified OBGYN and an international lecturer. You are the director of the Center for Functional Medicine in Stamford, Connecticut, right around the corner from me.
Absolutely.
You also serve as director of curriculum for the development of Functional Medicine Coaching Academy, and you are the medical director of K BMO Diagnostics, which specializes in identifying foods that cause inflammation. We're really going to talk a lot about blood tests, and again, it's blood tests as we lead into women's health. You're the chief medical officer for Health Point Solutions, which specializes in the use of artificial intelligence in medicine. You are honored to speak at the United Nations on the topic of prenatal origins of violence, and you do serve impressively as the UN representative and chief medical officer for OMAEP, the World Organization of Prenatal Education Associates. And again, you're the medical director of the Association of Prenatal and Perinatal Psychology and Health. You're on the advisory board of Toolbox Genomics. We could run a little in that. That's fascinating. They are, without question, dedicated to furthering the appropriate use of genomic testing. And you are one of the senior medical faculty advisors of one of the most recognizable, prestigious teaching institutions in what we call integrative/functional medicine. That is the Institute for Functional Medicine and the Center for Mind-Body Medicine. And in addition, you've been teaching an IFM module, which is very interesting, in hormonal health since 2011 for IFM. And you're that guy. You know, you studied spirituality, metaphysics, personal transformation for many years. And because of that, you've created a core curriculum designed to share ancient spiritual wisdom with others to bring health and happiness into their lives.
Yes, yes.
You are a busy guy. Do you sleep much?
Every time I hear that, I'm like, wow. But yeah, I manage to because, I practice what I preach, which is try to live an authentic professional life as part of an authentic life. And so what I do professionally reflects what I love and what I believe in. And
That's
so
that's so
that's it.
impressive because, as an MD, a lot of MDs, I used to go to, and they used to say, "Do as I say and not as I do." So I'm
Exactly.
happy to hear that
Yes.
you're saying, "Do as I do." That's
Yeah.
fabulous. So let's dig right in a little bit. What made you, as a world-renowned leader in functional medicine and women's health, decide to affiliate yourself with KBMO uh, blood tests?
So the funny thing about the answer to that question, and it's a great question, is that it's such a mundane story, but sometimes the power of the mundane, of the everyday, really has some power to it. So being involved in functional medicine for 20 years, I understand and have always understood the power of reactions to food as being positive, meaning what we eat can give us nutrients and really help the body to heal. And if we don't eat the right things, it can cause problems, right? Too much sugar, trans fats, heavy metals, etc. And then there's another piece, which is foods that cause a reaction in the body to the immune system that provoke inflammation or somehow irritate the immune system. And the fact that the largest immune organ of the body is in the gut it just makes sense that we have to try to figure out what are the foods that interact with the immune system in a harmful way. Yet, with the importance of that understanding and knowledge, there was a real lag in terms of what testing was available to help identify those foods. And so really, I had always been on the prowl looking for the right test. And so there were problems with the existing testing where you'd test for 400 foods, you'd test positive for 200. People didn't know what to do. That food testing was expensive, and I really was just in search of a good test. And then I just happened to be strolling at a convention in New York City
Mhm.
and found this booth that said food inflammation test. And at the booth, and actually it was a nurse who did the first uh, exploratory work and said, go over to this booth. It looks interesting. And it turns out that James White, the CEO, was there. And I said, does this test really identify foods that cause inflammation? And he said, absolutely, dummy. That's why it's called the food inflammation test or the FIT test. And, I said, this sounds too good to be true. I said, because I'm a functional medicine educator, and I know that inflammation is the underlying problem for almost every complex chronic disease that's affecting our society. So if we can find the foods that cause inflammation, that's a home run. And then it bypasses all of this nebulous research data, et cetera, about food sensitivity. And we'll talk about the different immunoglobulin subclasses, but it sort of takes the argument away from does an IgG reaction matter and brings it to we've identified inflammation because we know inflammation matters. And he's like, yeah, that's what the test does. That's exactly why we designed this test. The PhD scientist who designed this test is the one who designed the rapid home HIV test. So he's a smart guy. He understands this. And then, really it was, love at first sight, if you will. And I said, well, let me dig in a little bit. And that's when I said, wow, this is an incredible test. And I started using it in my practice, and the results were unbelievable. People started feeling better really quickly. Then I started using it on almost every patient in my practice, and the results were incredible across the board, no matter what their presenting issue was. And then we started talking more and more and more, and then I said, I got to take this on and help spread the word, and that's what I'm doing.
Well, you are the chief medical officer, is my understanding. And great point, because I saw that you're doing it. We also use it in the office. As you said, the FIT test, food inflammation test, it tests 132 foods, colorings, and additives. You made a great point in that you basically say food is a potentiator for inflammation. You talked about the gut, and we can go into that a little bit because everybody, that is the topic of conversation. 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. I'm going to ask you something about autoimmunity coming up, so I guess maybe you'll want to tie it in over there.
Mm-hmm.
And, it's interesting that you said about food and food sensitivity. So with that being said, why is food sensitivity so important to overall health and diagnostic for you from your position?
So let's just take the big picture aspect, which is we eat 3 times a day. Now, in the last year, that's not so true anymore because all of us are eating 1 or 2 times a day now. But in general, the population still usually eats 3 times a day.
Mm-hmm.
So you're putting something into your body 3 times a day or 2 times a day, and what you put in can have a positive or a negative effect. So it's almost as important as the air you breathe in terms of breathing in aerosolized toxins and chemicals and so on, because it's a constant exposure to the body. And so that constant exposure to those chemicals can either be helpful or harmful. And so I mentioned before how it's the importance of the nutrients we take in. It's important that the food we take in is free of toxins and heavy metals and so on. But because, as you said, 70 or 80% of the immune system cells are in the gut, what you eat has a profound impact on the immune system. And the reason it does is because the gut is a tube, and though we all think of the gut or intestinal tract as something that's inside the body, in reality, when we design the body, the gut is actually external to the body. So it's a tube, right? And so mouth to anus is a tube, and the body is very selective about the contents that are inside that tube as to what it lets in and what it doesn't let in. And it's the immune system which is designed to protect us against assault from bacteria and other foreign substances. That's why there's so much of the immune system placed in the gut, because that's our wall, that's our barrier. That's where we have to protect ourselves. So if that immune system that is stationed appropriately in the gut picks up things that upset it or trigger it or inflame it, that leads to a state of inflammation systemically in the body, locally in the gut, and can also trigger autoimmune disease. That's why gut health is so important when we look through the functional medicine lens, that no matter what is bothering you, start with the gut. And that's because an unhealthy gut triggers inflammation in the body, triggers decreased absorption of nutrients, and can lead to autoimmune disease. It affects neurotransmitters and brain health. And that's why identifying foods that trigger the immune system is so important for no matter what the imbalance is in the functional medicine matrix that you're addressing.
So with that being covered, which is great, the food sensitivities can stimulate the immune system, and you can cascade into localized, systemic, and ultimately autoimmunity, depending on the extent and the length of the assault from food. So once again, food is a potentiator for inflammation. So you and I will both probably say one of the first things that we're going to start with is change your diet. See what's good for you, individualize it, what's good for you. So I have some numbers. These are your numbers, so I'm helping you here. I'll be the number guy. Food sensitivity and related diseases affect at least 100 million people worldwide. And what we've seen, a tremendous increase in food sensitivities, 50% in adults and children over the past few years. Several food groups, the typical food groups: wheat, dairy, peanuts, soy, eggs, and the shellfish are high food sensitivities. So another question a lot of patients ask me and a lot of docs ask me is, what's the difference between a food allergy and a food sensitivity?
So that's a really, really important question. And so food allergy is really in the domain of the allergists and immunologists. It's a medical problem that can kill people. That's the anaphylactic reaction that causes the throat to swell, people can't breathe, people die. That's why you hear on planes that one person with a peanut allergy means that no one on the plane can eat a peanut. So that's through a mechanism in the immune system called IgE. That's not what we're talking about. What we're talking about is a different arm of the immune system called IgG. And IgG is what has been measured in the past with food sensitivities. And IgG is a response to something that irritates the immune system, but doesn't cause that allergic, hypersensitive, anaphylactic reaction. Now, if IgG is activated, that may or may not create a problem in the body. I would never tell you that having an IgG activation is a good thing, but I can't tell you why an IgG activation is a problem, or I can't relate an IgG activation to a specific health issue in different people. It's really, the research isn't there yet. But what we do know is that if IgG leads to inflammation, that's a problem. And so we are the only test that looks at IgG and links it to inflammation by measuring complement. And complement is the cytokine or the chemical that's produced when an inflammatory response is provoked. So if there's no complement, there's no inflammatory response. So we measure foods that provoke an inflammatory response. And that's where the money is. That's what the sweet spot is when you're looking for reactions to food. So what foods provoke inflammation? Now, why is that important to know? It's important to know because we're now more sophisticated in functional medicine and integrative medicine than we were 5 or 10 years ago. So 5 or 10 years ago, when this food sensitivity testing was the Wild West, so to speak, what we at IFM told people was, you know what, this is not an area of laboratory where the sophistication is appropriate. So we're just going to eliminate foods that most people are sensitive to and see how they do. We call that an elimination diet. Or what we'll do is encourage people to eat foods that are quote unquote anti-inflammatory foods, like salmon, for example, which is rich in omega-3s. And to, use a lot of turmeric, or curcumin in their food. And I think that's great. The problem with that is that there's a group of people that are sensitive to that. So if they didn't know, they would just continue to eat the salmon and the curcumin. So we test for that. And I find people that are sensitive to turmeric and sensitive to salmon. And they're like, how can I be sensitive to salmon? Because it's such a good food. It's an anti-inflammatory food. And the answer is yes, it is an anti-inflammatory food, but not for you.
Mm.
And it will be an anti-inflammatory food for you once you eliminate it. And once we heal the gut, because we can become sensitive to foods that we eat frequently because of this other entity out there called leaky gut, right? So when we think of the gut as a tube, as I mentioned before, and the tube is really external environment, the way we protect ourselves from that external environment is the cells of that tube are really close together. We don't let things in unless we want things to come in. If the gut has localized inflammation, let's say from this unhealthy microbiome, a disordered microbiome, emotional stress can do it, or even eating foods that cause inflammation can do it. But you can also become sensitive to foods you eat a lot just because you eat them frequently. And so when things go through that tube frequently, even if the cells are tight together, there's always a small amount of these food protein fragments that don't get broken down that cross. But they normally, if you eat a varied diet, they don't cross with enough frequency to create an immune reaction. But if you don't eat a varied diet, so you have salmon 6 days a week, then even if you don't have a leaky gut, you can become sensitive to salmon. So that's the importance of eating a varied diet. And then if you throw in leaky gut, which a lot of people have, people can become reactive to these quote unquote anti-inflammatory foods. So that's why this testing is so important.
Lot there. So you do the IgG with the FIT test. So IgG is the most common immunoglobulin. It passes the placenta. You actually test for a subclass of IG4.
1 through 4, all 4.
You do all through 4. Okay, great. You do all 4. And the C3D was that complement that you were talking about. So now you're looking for immunoglobulins and inflammation with immunoglobulins, which is critical.
Exactly. So in order for our test to identify a food as problematic, you have to have both the IgG response and the complement response.
So you got to have a little chronic, and you have to have the complement. That's great. So that you're the only test that does that. So that differentiates the fit test.
Correct. That's what differentiates us. We're the only FDA approved, markers, et cetera, and patented for this particular test. Now, people say, oh, do I have to avoid this food forever? No. So the half-life of this IgG is roughly 3 weeks, right? So if you stop poking the bear, you stop eating these foods, in 3 weeks, your antibody levels will be down by half, 6 weeks by 75%. So that's why I say 12 weeks, we get them down to pretty much an undetectable level. And that's why we can retest after 12 to, I always say, ideally 16 weeks.
Right, give them a little time. So 12 to 16 weeks to retest. And we're using these tests. I mean, I always explain as a doc, and I think you'll agree that we're using these as baseline. Otherwise, we're kind of like shooting a gun in the dark, and the gun being the treatment. We want to turn a light on, and those are these tests that we're talking about. Now, to piggyback on what you said about the food, like you said, most people say, how can I be allergic to, like you said, salmon? So it's fair to say that if you eat the food too much, and unfortunately you have leaky gut, which many of our patients have, you're then going to be—
That's how it happens.
That's how it happens. So in theory, we'll use salmon as a healthy food. We'll use natural chicken. Some people have come in allergic to spirulina and broccoli and things like that. So if they go through the program, 12 or 16 weeks later, it's conceivable that they'll no longer be allergic to the food, because we fixed that barrier called leaky gut.
Right. So we have to do two things. We have to avoid the food, and then we have to be really good with the gut health regimen. So if people aren't compliant with taking the pills and the powders that we prescribe, then they'll have to stay off that food a little longer.
Excellent. So that gives everybody some hope. It's just a duration of time. It's not for perpetuity, certain foods. Although there are certain foods that we both probably would agree that we wouldn't want people to eat, and things like gluten and things of that nature. But specific to the test, you may be able to reintroduce. You talked about the elimination diet. So then you would may reintroduce. Do you want to?
Right. So that's an interesting thing. So the elimination diet is based on the premise that symptoms are the indicator for deciding whether a food is a problem or not. When in reality, what we know is that symptoms are just the tip of the iceberg when it comes to food reactions. And so the asymptomatic food reactions are actually more important than the symptomatic from a doctoring point of view. From a patient perspective, clearly they're concerned about symptoms. But from a doctoring point of view, you want to take away the inflammatory response, because chronic inflammation will set you up for the development of chronic disease, even if the chronic disease doesn't exist yet. So we know cancer, for example, cancer starts in a bed of chronic inflammation, and it takes a long time. So the foods that cause chronic inflammation, if consumed, can set you up for that environment of chronic inflammation and development of cancer, because we know cancer is an inflammatory disease. We know heart disease is an inflammatory disease. That's different than the inflammation that comes when you have gut symptoms from eating a food that doesn't agree with you. So someone may have their gut symptoms restored, but we have to do the test because we want to make sure they don't develop heart disease or cancer.
You know, what's also interesting, speaking to docs and patients with this webcast podcast, is that some people say, I'm shocked that I'm allergic, or I have sensitivity to food because I don't feel it. And I think that we should talk about the delayed reaction with the food, hours, days.
It can take up to 2 days.
Yeah.
And sometimes longer to have that reaction. And so it's very hard to know just from either general awareness, or even if you're doing a food diary, because your foods are varied. So it's really hard to know. Like, so when we talk about an elimination diet, it's sort of one food that you introduce for 3 days to know that if there's a symptom or not.
So that takes care of a lot of that. That's one of the biggest things that I get in my patient base. I wanted to ask you, you're an OBGYN by training. This is your area of expertise. Is there a relationship with the food sensitivity and women's health and women's hormones?
So there is, and I will tell you that though I knew about this, as I started working more intimately with KBMO and digging deeper into literature, I was shocked at the relationship between gut health, leaky gut, food sensitivity, and women's health issues. And this goes, there is a tremendous body of literature. I give a lot of lectures on this from preconception, so that we are talking about optimizing the chances of getting pregnant. So preconception health through prenatal care, how gut health is important for reducing the likelihood of pregnancy complications like preterm labor and preeclampsia, how dealing with infertility like PCOS, the relationship of PCOS to gut health, fibroids, endometriosis, the inflammation, the change in hormone production that happens with gut inflammation. Then we move into midlife and breast health and breast cancer prevention. Then we move into perimenopausal symptoms. We talk about brain health, depression, mood issues, anxiety, all affected by gut health. And even osteoporosis is affected by gut health and leaky gut. And I'm, busy preparing a book on menopause and perimenopause. And, this is a big piece of that. And it's just incredible how not only gut health, but food sensitivity and gut inflammation affects all aspects of the hormonal milieu.
Wow. So there's a direct relationship with these food sensitivities and all these things that are going on in the female population. And a lot of it is attributed, and I think we're getting to a major theme here. The food sensitivity damages the gut becomes permeable. We have intestinal permeability, leading us down a path of, once again, inflammation, chronic inflammation,
You got it.
autoimmunity. So you and I are singing the same song, just in a little different
right.
tune, in that we all want everything starts in the gut. Hippocrates said that. So those who are having some indigestion problems definitely should have a food sensitivity test without question. Who should take this test? What should the doctor, what's the patient population?
So basically it starts with a question, do you want optimal health? Do you want optimal aging? Because if the answer is yes, this is clearly a part of that. Now, as you know, you read from my bio that I have a position with the Functional Medicine Coaching Academy. So how we interact with our patients is so important to optimize the possibility of them getting well. And so we have to meet them where they are. And I have patients that come in and say, you know what? Optimal health, optimal wellness. Yeah, I can't say no to that. But right now, I've got a specific goal and I just want to work on my gut issues. And once my gut issues are better, then we can start thinking about these other things. So you have to meet your patients where they're at. But I start with that question, are you interested in optimal health? Because if the answer is yes, then everyone needs this test, because I have a significant number of patients. I've got some athletes, I've got people that are interested in performance, and they need to know this because their performance is improved based on their food sensitivities and what they remove. So what do you want your health for? Whatever the specific issue is that they're coming in with, whether it be migraines, gut issues, arthritis, people that come in that are going to have a knee or a hip replacement, I'm not saying that we can grow cartilage by doing a food sensitivity test, but what I can tell you is that by reducing some of the inflammation that comes from other places in the body, that when we combine that with a strong anti-inflammatory regimen, they can potentially do more rehab and potentially not need surgery. So there's lots of reasons to do this test. It's either optimal health, we can always relate it to a specific health issue, or complaint.
That's great. Well, let's talk any studies on the fit test that you have available to discuss?
So we do. So, that's always been an important question from other doctors when I talk to them about this test. And so we have commissioned an independent study through an independent institutional review board. And what we have found out was that this fit test works in patients with IBS. So irritable bowel, clearly a very common issue. And the reason we chose irritable bowel is because when you look at the literature for other types of food sensitivity tests, that's the clinical group that they use to measure the effectiveness of their test. So we looked at IBS patients, and we looked at what's called the IBS symptom severity score. And that's just a way to quantify objectively, give patients a number with their symptoms. And then what we did was we gave them the test, we eliminated the foods, and then we had a control arm with just people eating a normal healthy diet. And what we found was we significantly reduced their symptom severity score by a very significant, tremendous number. And when we compare the number of our reduction, which was close to 80, what we found is that that was better than the other comparable symptom severity score reduction in any other food sensitivity test. So our test reduced the symptom severity score better than other food sensitivity testing that's out there.
That's outstanding. And that was for IBS. Reproducibility, I know we had talked about that before we went on air.
Yes. So we've done much reproducibility studies, and those reproducibility studies are always consistent in the high 90s. And what I wanted to say is our number was 120, about 120 that we dropped. Everyone else dropped about 60. So I just wanted to correct that.
Times. That's outstanding.
Yeah. So so we're reproducible. We've done the split sample studies. We've done, everything that a doctor questions about reproducibility when we're looking at a food sensitivity test. Our lab has done it, and it's valuable. Otherwise, I wouldn't put my name and reputation behind it.
Outstanding. That's great. I think you had told me they were like 99.1 and 98.6.
Exactly.
So fantastic reproducibility. And that's really critical if you're going to look at the stats and the research, how viable it is because of its reproducibility. So a little look into the future, if you will. Zhanlin, key biomarker for intestinal permeability, tight junctions, leaky gut, protein that's synthesized in the intestines and liver cells. Any news on possibly testing for Zhanlin in the future?
So, zonulin is what causes those tight junctions to separate. And so measuring zonulin levels has always been a bit of a clinical conundrum in the laboratory. And we have partnered with Alessio Fasano from Harvard, who really came out with the pioneering work on zonulin. And he has designed for us the next generation Zhanlin testing, which should be out very, very soon. And this will enable us to diagnose leaky gut with more precision than any other lab out there, because we will have sort of a three-legged stool to diagnose leaky gut. We will have the most accurate zonulin assay designed by Dr. Alessio Fasano. We have an ability to diagnose leaky gut by the number of foods that test positive. So if you're testing more than 8 or 9 foods positive, you've got leaky gut. We test for candida. If candida is positive, that shows you have leaky gut because you've got candida in everybody's GI tract. But if your immune system reacts to it, it's because it's crossed through the barrier. So between those 3 assays, we can diagnose leaky gut with precision, and no other lab will offer that.
My understanding is that's coming real soon.
Very soon, yeah.
Excellent. So now we're going to be able to test for a leaky gut to see the damage that the food sensitivities may have caused.
And when we do follow-up, it's not just about following up with, did the food sensitivities go away, but we'll be able to track zonulin levels.
Outstanding. That's going to be so much more baseline diagnostic for all the practitioners and for the patients. Everybody's going to benefit. It's a win-win, if you will.
Yeah. And so the other things that are coming up is we're coming up with a rapid test, which will be available in the early spring, which is something for doctors to be able to offer patients in their office and give them the answer right away with gluten, dairy, and egg.
Wow.
And those are the big 3. And the thought there is that if they come up for one of those 3, then they're going to need the full fit test. So I think that that's really, really important. And that's exciting. That's exciting because it's not going to be expensive and doctors can do it right away. And at least they'll be able to talk about gluten, dairy, and egg. And then we're also going to be expanding the fit panel, not just 132 foods, but we're going to expanding to 176 foods. And what that will do is it will enable us to talk to patients about some of the grains, like quinoa and so on, the things that people are beginning to eat more of, Brussels sprouts, et cetera. So I think that that's an exciting thing that's coming as well in the early spring.
Those are both great changes and additions. The Zhanlin is great. And of course the rapid test, because basically I've got everybody stopping gluten and dairy, and eggs always pop up because we all eat them. I'm scared to get tested again because I don't want to lose eggs for a little while.
Right.
Fix my gut.
Right.
So those are great things. And agreed, quinoa and these ancient grains now have become very popular as alternatives to the gluten and everything. And as you said, they may be healthy, but not healthy for you at this time.
Exactly. That's it. That's the line. These are healthy foods, but maybe not healthy for you.
At this time.
Exactly.
Great. So is there anything else you'd like to discuss? We call it parting shots here, Proven Health Alternatives.
Listen, I think that this was, really comprehensive. You asked great questions, great interview. This is a great podcast you have. I think if people want to contact me, if they're interested, my website, which is thecffm.com, for the Center for Functional Medicine, or they can email me at Joel, Joel, at thecffm.com.
Outstanding. And everybody knows it's the fit test. It's out there. They're able to get it. It's a leader in food sensitivity.
Yeah, and go to that website, right? KBMOdiagnostics.com. There's videos. I give 40-minute lectures on those videos. You can really learn a lot from those.
We have to do this again when the new tests come out in a few months. We got to get you on and update everybody.
That'd be wonderful.
Dr. Joel Evans, located very locally in Stamford, Connecticut. Dr. Rob Silverman, Proven Health Alternatives. Thanks for coming on in, and
thanks,
always
Rob.
yours in health.
Okay, good. Bye.